FM 104 KUOO Campus Radio, Becky Thorson. Time for our update with Windom Area Health. And joining me today, Kaci Paradis, Clinic Program Director and Nurse Practitioner at the Wound Hyperbaric Healing Center at Windom Area Health. Hi, Kaci.
Hi.
Hey, I understand you want to talk about diabetes awareness today.
So November is Diabetes Awareness Month. I will explain just a little bit about diabetes. Diabetes causes excess blood glucose in the body, and so this is kind of a short, quick version of diabetes. These small vessels supply blood to the nerves in the body, and when these vessels are damaged, it can lead to damage to the nerves, which lead to the muscles and cause muscle weakness and loss of sensation, and this is ultimately called neuropathy. Those that have diabetes can develop neuropathy in their feet, and diabetes is the number one cause of neuropathy. Since neuropathy causes loss of sensation in your feet, you may step on something or injure your foot, and you may not even notice that there's something there. Diabetes can also cause wounds to heal slower than the average person, and diabetes can also have compromised blood flow to the small vessels, as I talked about earlier, in which toes could be affected, and all of these concerns can lead to ultimately the amputation of your toes, your foot, your lower leg, and we in the Wound Center want to prevent this from happening.
Well, sure. What causes diabetes?
There are multiple risk factors that are involved in developing diabetes, but being overweight and genetics plays a big role, and then also the type of diabetes a person may develop. According to the CDC, 29.1 million Americans have diabetes, and 15% of all diabetics will develop a chronic wound. And patients with diabetes have a tenfold increased risk of amputation, and about 70,000 diabetics will undergo an amputation a year, which is huge.
Yeah. What can you do at the Wound Center for diabetics?
What we can do at the Wound Center is a quick and painless test called a monofilament test, and this is where we place a small, thin plastic catheter to the bottom of your foot and press it in certain areas, and then the patient will tell us if they can feel anything or not. This is a really good way to tell if they have nerve damage from that condition we talked about earlier called neuropathy.
What are some of the signs and symptoms of diabetes?
They can be very thirsty, have frequent urination, sugar in the urine, which would be found from doing like a urine analysis with their providers. If they're testing their blood sugar, they have high blood sugars, being very tired, and then wounds that take a long time to heal.
So how would someone know if they have diabetes?
Just reviewing your history with your primary care provider, any signs and symptoms that they have maybe developed that they have brought forward to their primary care provider, and then drawing blood work can kind of show if they have diabetes or not.
You mentioned that you can end up with an amputation of the toes or feet. What can one do to prevent this from happening if they are diabetic?
Studies have shown that advanced wound care treatment facilities such as ours in Windom Area Health have reduced amputation rates and shortened hospital stays. COVID-19 provided evidence why wound care is so important. During this time, wound care saw a decline in visits, and this led to a significant increase in major limb amputations in comparison to the same pre-COVID time. Studies are showing that almost 50% increase in amputations during that time. And diabetes is a chronic disease that causes patients to manage this disease for a long time or their lifetime. These patients may develop a wound that may not heal due to infections or poor blood flow and neuropathy. These wounds are called diabetic foot ulcers, as we've been discussing. They can develop on their feet, toes, or heels, and these patients, again, may have developed neuropathy, and the wound itself may not hurt. They may not even know it's there. The wound may take weeks to heal, and this is where Wound Hyperbaric Healing Center at Windom Area Health comes in. We utilize advanced modalities to heal patients with these types of wounds, and these special wound dressings and debridements, compression therapy, hyperoxygen therapy, prescription growth factors, advanced cellular products, edema management, and non-invasive vascular assessments are all things that we can do here at Windom Area Health.
That's just amazing, everything you do there. What can patients do to take care of themselves and their feet if they have diabetes?
If you do have diabetes, maintaining a good sugar control, inspecting your feet every single day, protecting your feet, meaning never going barefoot outside or around your house. You should have some type of protective wear. Reporting any signs and symptoms to your provider. Avoid cutting your ulcers or calluses yourself. You can also come see us at the Wound Hyperbaric Healing Center at Windom Area Health for all your wound care needs, as well as diabetic foot concerns, and there are no referral processes. Anyone can call or make an appointment.
Do you have someone who will see patients for foot wounds at Windom Area Health?
Yes, we have Naomi Bach. She's a nurse practitioner here. She's been doing wound care for many years. We have Lori McInerney. She's also a nurse practitioner here. And then Dr. Nichols, who is a podiatrist. And we are open Monday through Friday, 8 a.m. to 4:30.
Okay, if someone wants to get a hold of you there, how do they do that?
So if you're interested in setting up an appointment for yourself or your loved one, you may call Windom Area Health at 507-831-2688. 888-224-2400. And for more information, you may check out the website at windomareahealth.org and be sure to follow us on Facebook. And you do not need a referral to come and see us.
That's important to note, and lots of great information online, windomareahealth.org. Thanks for all that great info, Kaci.
Thank you.
There's Kaci Paradis, Clinic Program Director, Nurse Practitioner at the Wound Hyperbaric Healing Center at Windom Area Health. See details at windomareahealth.org. And that's our update on Campus Radio.